Haya, wacha tuingie mambo ya World Toilet Day sasa. Wali is in studio with us as promised, and we'll discuss sanitation matters, the importance of sanitation, access to sanitation in Kenya and Africa, and of course, what marking this day means. We'll always need a toilet. That's the theme for the day, right? We'll always need a toilet. Why don't we like talking about it?
Nice.
Let's start from there. Hi, Wali.
Hi.
Karibu. Before anything
Asante.
else, let Janu share the quote of the day with you, and welcome back, by the way. Let
you.
Janu share the quote of the day with you, and you can say what it speaks to you. if anything.
Absolutely. Pumla Dineo once said, "A society reveals itself in what it chooses to fear and what it refuses to confront." Yeah.
Wow. That's a great quote of the day on World Toilet Day, right? And for me, it actually resonates with the theme. We said the theme 2025 World Toilet Day says we all need toilets. Is there anyone here who hasn't used the toilet today? Is there anyone online who hasn't used the toilet today or this morning? So we do have toilets, and we do need toilets. It's a necessity. And so for me, the quote actually resonates with me because the work that we do, we choose to not confront the fears because we don't want to take responsibility. We don't want to be accountable, right? And if we choose accountability, we will actually take these challenges, make them our own, live them, and want to solve them, right?
Like that.
Yeah.
Yeah.
That's a beautiful one. Vali, you're a sanitation and public health specialist, and you've been in this space for a while, looking at it from a policy level and then looking at it from an implementation level. I want to start by today's World Toilet Day theme is we'll all always need a toilet. Looking at it from a public side, do we think about toilets? Not as government, as policymakers, as citizens, do we think about toilets?
That's a great question. So I want to say yes, and to some extent, no. So we do think about toilets when it's
Time to
it's
go.
time to go, right? You will think about it. You will try to find it.
Yeah.
You'll figure it out, right?
Yeah.
But after figuring it out, do you think about those who don't have access to a toilet? That's the question we should be asking ourselves. Because I think we take it for granted. We sit in our homes, you have the toilet. You can wake up, go to the toilet anytime. But you can imagine for at least 3.6 billion people in the world, they don't have access to a toilet.
That's a big one.
3.6 billion. Earlier I said 3.4 billion. It's
Yes,
3.6
it's
billion.
3.6
billion.
Yes.
It's almost 4 billion people.
That's almost half the
Half,
population of the world, right?
Imagine.
Who
You
don't
know,
have access to a toilet.
I like the way you responded by saying that we all think about a toilet, but at that point when we need a toilet.
Yes.
Before that, we don't. After that, we don't.
Yes.
And sometimes we actually do think about it when you're planning the day. I remember having a conversation with some ladies, and they were saying, I can't have water. I can't take a lot of water because today I intend to go downtown. Because of where you're going. So you're already thinking, at some point I will need to use a toilet. And where I'm going, I am not sure I'll have access to a toilet.
Yes.
So it doesn't matter who. At some point you will be thinking, as you're planning your day, where am I going to be? So therefore, especially for ladies, what am I going to wear? Because of the access to a toilet. Whether
I'm
it's
going on a road
uptown or downtown. Where you're going clubbing, you're thinking, are the toilets in that facility good, clean and all? So what am I going to wear? These
I'm
things
Going on
happen.
a road
Yes,
trip.
even on a road
trip.
trip, yes.
At
I'm going to
what
be on the
point am
road
I
for
gonna-
8 hours.
Yes.
I know the cleanest restroom is at the 4-5 hour mark. What that means? No drinking water.
Yeah.
Yeah.
I hydrate very differently ahead of road trips.
Yes.
You see?
Or
You
when
plan
you
for
hydrate, or you hydrate and then you take something salty.
Then,
literally.
yeah, just to hold it in.
hold
Yeah.
it
To
in.
try and hold it in.
Yeah.
Yeah.
So you can imagine now when those of us who think like that, you're thinking about, once in a while, at some point I know I can stop by. I'm going towards Nakuru, I can stop in Naivasha and I can afford to pay for a toilet and so on and so forth. There are people who, that's the entire day.
Yes.
You wake up in the morning and you are not sure you are going to use the toilet for your first toilet need that day.
Of the day, yes.
How many are there in Kenya?
Wow. In Kenya, we are seeing right now, we are at least at 5 million people practicing open defecation because we know that those are the people who don't have toilets. Now,
5 million.
5 million. When we think about those who have toilets, but the toilets are not dignified options for them, of course, there are more, right? And majority of these are in rural areas, which are underserved, but also informal settlements, because we can't plan for them, right? We can plan as much as we can, but the infrastructure is strained already. This is infrastructure that was constructed years ago. The solutions that are there will not fit moving millions of people to just construct the infrastructure or to put up the infrastructure. Again, we have the accessibility in terms of the affordability of these toilets. How many people can actually afford? Are we bringing solutions that are affordable to the people and for the people? The last part, which I like what Eric said, you think about it before you plan, and after you use the toilet, you don't think about it after. Are people actually accessing safely managed sanitation options? Because where does the waste go? That's the other question we have to ask ourselves. How is the waste being managed? Does it come back to the same environment, the same communities who are using these toilets? And if so, what impact does that have on the health and the productivity of those communities?
Yeah, in fact, I was going to say a lot of the time we think about the World Sanitation Day, World Toilet Day, we think about the physical toilet.
Yes.
But there's an entire other system that also needs to be played. Earlier on, I think it was Mariam or Eric when you talked about what is a safe toilet. But what's safe sanitation?
Yes.
Safe toilet, safe sanitation. Talk to us about World Toilet Day beyond the physical toilet.
Yes, that's great, and a great conversation also to have at this point. Just wanting to highlight even the progress that we've made as a country so far. So the Ministry of Water and Sanitation has recently just completed the National Sanitation Management Policy. What this policy has done for the country, it has also shifted the priorities for the government, right, in terms of sanitation. So we are now looking at safely managed sanitation as a whole, right? We are thinking, previously we were saying we are going to do 80% sewer connections and 20% non-sewered sanitation options. The government has had the good realization that this is not a possibility. And so the shift has now happened. And we are now saying we want 60% non-sewered sanitation because most of the population will actually not get connected, right? Now, what that means is you're not only thinking about toilets, the physical component, but what happens to the waste? So when you put up a sewer, how are you thinking of maintaining it, rehabilitating it to ensure that it's getting to treatment, that waste is getting to treatment? When you have non-sewered sanitation options, these are mostly on-site. We are using exhauster trucks who are collecting the waste. Are they also transporting the waste to treatment? We are using pit latrines. Some of them are manually emptied. How are we enabling or formalizing that emptying process? Because this is still a sanitation service being provided for the very core who are using it and the majority of the population in cities, right? So how do we now connect them to make sure that this waste also gets to treatment? And when we are talking about safely managed sanitation, it means you poop, and that waste actually goes throughout the service chain, along the sanitation service chain, through emptying, transport, and treatment. Because until the waste is treated, then you don't have a safely managed system.
As it stands, and I know the numbers are scary. Actually, I'll come back to how much of our waste actually gets treated and what happens to the rest of it. But just thinking through the history of toilets here, what's the African version of what we call a toilet today? What was our history? How did we pee and poo? Because open defecation seems to me like something that has happened in the last few decades or the last century.
Yes.
Yeah, I don't know. Maybe I'm being crazy.
No. I mean, of course, we talk about our forefathers, right? Decades ago. But was the population at the current population? For example, in Kenya, we are now 53 million people. We were not 53 million 4 decades ago, right? So if all of us would openly defecate if we didn't have a toilet, it means that waste would not be close to communities. It would not be in the same environments that we are living in. That was a very different, those are very different centuries, right? Looking at the population increase right now with rapid urbanization, And even without urbanization, people not moving from rural to urban, even in the rural areas, the populations are growing, right? Right now, if you think about your grandmother's house, while it was one compound with 10 acres and you are the only household there, you could dig up pit latrines and have the pit continuously fill up, and you close it up and nothing happens. You dig another one. Right now, that's not a possibility, right? Again, we didn't think about the disease spread. So right now, what is impacting the health and economic productivity is actually that unsafely managed sanitation system, right? People are growing, the populations have grown. We are using more, we now have a more people per toilet ratio, right? Regardless of where you are, that's the case. And then when people interact and they're using unsafe systems, it means also transferability of pathogens is very, very easy. It's much easier. Yeah? You have a toilet, you don't have a hand washing station. So you are not even practicing safe hygiene practices. We are looking at water scarcity and water resources depleting. How many people have access to now clean water to wash after going into the toilet? So it's not just about safe management, but the whole wash circle itself, and what gets into it.
You brought in the word safe, and earlier at 6 when you were saying that you'd be coming, we asked ourselves, so what's a safe toilet?
Yes.
Right?
So a safe toilet means...
We've been trying to figure out, does safe mean access to water? Safe mean access and light? Does safe mean all these things we talked about, collection and transfer to treatment? Does safe mean treatment? What is a safe toilet?
So a safe toilet means you access a toilet that is clean, dignified, first of all, right? Which means it's private, and especially for women and girls, right? It allows you that privacy. Then, and not only privacy at the point where you're accessing it, where are you going to access it also? So the safety of that, right? The safe also comes with safety alongside it. We think about a good example is our informal settlements. Right. Do you have to walk 10 minutes to a toilet, or do you have to walk 2 minutes to access a toilet? At night, even worse, right? For women and girls especially. And then now, does the waste also remain in situ? Or is the waste conveyed outside that community? So that's what entails a safely managed system. Yeah, where you're not living in your own shit, so to speak.
Poop.
Yes, or poop. Yes.
By the last time the same thing happened.
I mean, we always talk about it. Yes. Yes, poop.
Pee and poo.
Yeah.
Well, now, what about accessibility? Because we were talking about that, and we were just trying to figure out what a safe toilet is. Accessibility for children.
Yes.
Accessibility for persons with disabilities, for the elderly, because I think, a lot of toilets are built for someone who can stand, squat, get up, and then get out.
Yes. So we are looking at both equity and dignity, right? Equitable access means it can be accessible by everybody. That's where we have the people, differently abled people being able to access, children being able to access, women and the elderly also. And then the dignified portion is when it's private, clean, and also the waste is managed properly. Yes.
Okay.
I know later we'll probably obviously speak about the fix around it. But for now, I'm trying to also figure out behaviorally, how much are people aware of their needs? Does that make sense? Because I think some people understand this is my life and situation. You almost get the sense that either there's a lack of prioritization in terms of what people who don't have access have, or they also don't feel like they have the agency to push for the fact that toilets are needed around them, or that they feel like, we just go with what we have. Behaviorally, is there a kind of like a shift where they're now demanding and saying this is absolutely not how we can live anymore? Or is there just a concern that there's almost like a complacency and it almost comes from being ignored for so long?
Yes, so in terms of behavior, again, we think about behavior change being pushed by policy and advocacy, because we need to have frameworks in place that now push for that advocacy. And advocacy is now telling people that you need to actually think about the toilet and not just the use of it, so that it's not just a structure, but what happens after you use it? And how does it affect you in your environment that you're living in, right? We have seen a lot of shift in people even taking up their own initiative and constructing these toilets themselves, right? But without standards, which come from the policies, will they be constructing dignified options? Right?
Where
will also these options that they are thinking about and getting creative about be equitable, right? One person can construct a toilet at, let's say, 20,000 shillings. Another person will say, no, I don't have the 20,000. Let me do a makeshift 5,000. And so if there's no standard, right, in place, then you also don't have equitable access or dignified options all through.
If there's no policy as well.
There's no policy.
There's nowhere where all this pee and poo is going.
Exactly.
So you've built the toilet, and then what?
And then
It's a
what?
jar.
Yes.
Okay.
Yeah, and they're not thinking about that when they're building. They'll say, yes, I actually do need something to use, but I'm only thinking about the structural component.
Yeah.
So a lot of behavior change shifts actually come with advocacy, and advocacy has to be supported by policy frameworks.
Okay.
Yes.
What percentage of Kenyans have access to sewered sanitation?
So right now, the sewer sanitation coverage in Kenya has actually dropped from 16% to 15%.
Dropped. Okay.
Yes.
Okay.
Because, and this is not a drop because the government is not doing anything. It's a drop because we have increased
Our population is growing.
size, right? So it means more people are lacking access. The infrastructure in place currently still needs to be expanded, extended, rehabilitated for it to reach everybody, right? And the rate at which the population is growing is not commensurate to the rate at which the government is able to improve these systems.
Right.
Yeah, because then they are also requiring heavy investment, right? We also are requiring a lot of innovative approaches now. Now that we are saying nationally, for us to reach our 2030 goals and meet the SDG goals, we now need to start focusing on both sewered and non-sewered sanitation. But what does that really mean? What do we really need to do to get there?
Actually,
Right?
that's now the next half of this conversation. What do we need to do to get there?
Yes.
But now, if 15% have access to sewered sanitation, non-sewered sanitation?
So non-sewered sanitation is about the remaining 85%. No, so maybe 80%, with now 5% who are practicing open defecation, yes, who don't have any access.
So the numbers are just worrying
Yes.
all across. But yeah, it's to come back and say, what do
What
we
do we do?
What do we need to get there? Okay,
Yes.
we'll come back and try and tackle
we
that.
call
Yes.
out the laziness
Yes, of who? Of the people who are supposed to be mandated
of
to.
the policymakers. Look, our population is not growing by another group of Maasais landing on, the way Maasais believe
That they
we
landed
arrived,
from.
right?
Yeah.
That's not how our population is growing. We can project
Birth
how our
rates.
population is growing. So if we cannot develop our infrastructure in tandem with our own population growth, that is laziness.
It's treating everything as a surprise factor,
Yes.
which we do very well here. Like, oh my gosh,
Meongezeka.
youth bulge maze.
You people of reproductive age, you're giving birth.
Yeah.
My word.
That's reproductive age. Lest we forget, it is World Toilet Day today. Every year on the 19th of November, there is a focus on toilet sanitation and what we need to do to make access and equity affordable for all. So we have Wali, Wamugongo. We'll come back and have this conversation coming up to 7:30. Rahemtullah Omar, India case study is important in sanitation, where millions of toilets were built, comparing in the past when people, especially women, were using fields to relieve themselves. Edwin says it's a matter of urban planning and affordable housing. Why are counties allowing landlords to build one-room houses with unhygienic shared washrooms? Okay, that's that perspective. Yes, okay, that's essentially what they're weighing in on. India comes up a lot, and we were just talking about it in the break. Is there anything that you still, when you look at the model, when you look at how they've progressed, what is the one greatest lesson we can learn from how they've managed, if they are effectively managing their toilet and sanitation?
So I think the most effective model is actually government goodwill. So if the government takes this up and it's urgent to them, right? We are seeing what happened in India is their growth actually was propelled by community-led total sanitation. So we are talking about policies, frameworks, innovations, right? But you're not supposed to build for the people. You build with the people, with this community. It's not a one-size-fits-all, right? I'll give an example of Fresh Life right now. We are building toilets, right, in the informal urban settlements. We provide these toilets, but we work hand in hand with the communities, right, for advocacy, for management of these toilets, right? Because if you don't build it with them, then there's no ownership. To what Eric earlier said, how do we all get accountable? It is actually that collaborative building, and this is what has worked for India. So community-led total sanitation, they put the Vijijis and the communities together, and they built for themselves, knowing that they will also manage these sanitation systems and what it means to them, right? But also largely it was driven by government, right? And for government to also drive this, it means investing in it. It means our budgets need to actually include sanitation in the line. It should not be called wash, because most of the time then it gets lost in the water.
Builds dams.
It builds dams. Builds pipes, right?
Yeah.
And then the sanitation component always is missing out.
How do we budget for sanitation currently? Yeah, you said it's under the wash line. So there's no separate budget line talking about toilets, sewer systems, and such?
Yes, so right now in our national budgets, it's usually a water and sanitation budget without line items on sanitation specifically. Now, as I mentioned earlier, the current National Water and Sanitation Investment Plan has actually broken that down into focusing on sanitation.
Okay.
Right? Because the government is recognizing that this is urgent. In order for us to reach the 2030 goals, we actually need to do something about it. We are seeing a shift in for example, having at least from 0.1% of our GDP being allocated to sanitation, we want a 0.5%. That's a huge shift. That's a big jump. So we are expecting that next year's budgets will actually have sanitation lines. We know that sanitation is a devolved function in Kenya, right? It comes down from national government. The National Sanitation Management Policy has said we need 60% non-sewered sanitation, 20% sewered sanitation. What has that done? We are seeing shifts even in the strategic planning, both at the national government level with the waterworks development agencies, putting an emphasis on rehabilitation and extension of these sewer lines where sewer lines are available, right? And then we are also seeing a great shift at the county levels, which is at the utility level. And utilities are the ones mandated to provide these services. They are also shifting their strategic plans to make sure that they are planning for sewer coverage and even using innovative models such as container-based sanitation models such as the Fresh Life toilets and also simplified sewers, especially when you're thinking about servicing the underserved, the informal settlements which are densely populated, right? You need to create systems that would fit that context. It's not the normal sewer line. Otherwise, a simplified sewer system is a smaller sewer system that actually joins different households together and then joins to a larger sewer line, which now collects and takes the waste into the treatment plant. So instead of moving millions of people to construct a large sewer trunk, you just do smaller sewer trunks that are now connecting to the households directly. So such innovative models are what the government has now taken into consideration, and they're putting budgets for this, right? It's not going underwater anymore, right? They're having separate budget lines. We are seeing that even with the current Nairobi Water Strategic Plan process. The third thing is now policies and frameworks. We are seeing this cascading down even to the utility levels, where the utilities now have like social connection policies to just make sure that they're accounting for the advocacy pieces that Janet was talking about, the community-led pieces, right? How do you bring the community on board in terms of ownership and management? A huge component of it is also now the climate action, right? We are saying, yes, we need innovations in sanitation, but are they climate resilient? Are we building climate resilient solutions, right? Again, another example is our Fresh Life toilets. We are building for resilience.
What's a climate resilient solution?
A climate resilient solution is a solution that would actually withstand any climate shocks. When it floods, it's not flooding. When there's drought, it's actually not affected. The system is not affected. So you have to take that into consideration even when you're thinking about innovative solutions.
Okay.
Yeah.
Nothing there about perhaps turning poo into energy.
That's also something else. So that's the end of the chain, right? We are now saying, where is the waste going? We are looking at reuse, treatment and reuse components, right? There's a big push for even carbon credits. Can we gain carbon credits from sanitation waste, right?
Oh.
Fresh Life
Walk me
is
through.
a
Hold on.
trailblazer. Yes,
How do we get carbon credits from sanitation?
exactly.
Okay.
So when you're thinking about carbon credits, you're thinking about reduced
Trees.
carbon emissions.
I'm
And
thinking
when
trees,
you're
that's
thinking
exactly.
carbon credits, you're also like, oh yeah, I'll plant trees around my
Yeah.
toilet. No.
Yeah.
You can actually realize carbon credits from sanitation systems. So a good example is also, again, the Fresh Life system, because we have container-based toilets. On a regular basis, these toilets are collected, right? So the waste is not sitting there. Unlike pit latrines, which emit a lot of which have a lot of methane emissions, you reduce the amount of methane emissions, and that's how you realize the carbon credits. So when you're thinking of innovations, we are saying think about systems that will almost be complementary to everything that we want to achieve as a country, right? And climate action is one of them, and it's a big component. Right now, we are also seeing this factor into these policies and frameworks.
Does the treatment of waste emit methane?
To some extent, yes.
Okay.
Because then they are treating it and there is no reuse component. And most of it is actually already waste that is sitting there for a long time for that treatment process to happen. The less emitting treatment process is what is anaerobic. If it's aerobic, then it means you would have to be emitting emissions. The second part is when you look at our treatment facilities, there's a lot of energy use, high power use. Can we move towards solarization, for example, right? It means you have also less emission and contributing to
all the
climate
things that have been
action.
planned for solar. Sometimes I'm like, hey, enjoy
That's
itachoka
funny.
siku moja.
Is there a case
Very
study that
interesting.
stands out to you? I know we're looking at different demographics and countries and all, but is there somebody who's gotten it right, especially that full circle where even the waste is able to be used again, so that we see how to do it at scale and what financing models would be needed? Because I
Yes.
know that's going to need more than what's been budgeted for.
Exactly.
So any place that stands out that's
So-
fixing this toilet issue?
So one of the closest to my heart is, of course, Fresh Life. We are already doing the full circular
country.
economy model in Kenya. So
Okay.
Kenya, we
You're just
already
like,
have
Kenya,
Fresh
it's
Life in
us,
Kenya.
okay.
Yes, Kenya is us, right?
Okay.
Because we have the full model being implemented. South Africa, the same thing. We do have a full sanitation, circular economy models in sanitation. We are seeing a lot of this also in some countries in Asia, right? Trying to propel this, because it's not something that can't be done.
Yeah.
We just have to figure out the most innovative way of doing it and actually mobilize resources to do it. And so bottom line, it comes from what can we learn from India? Government has to take it as a priority.
Yeah.
And they have to have the urgency to fix it.
Okay.
Yes.
Has to be that a policy and budget. It has to have urgency, yes, within policy and budget lines.
And
because-
goodwill.
And
A lot of-
goodwill.
A lot of
Yes.
commitment
Yes.
to it. Should we separate, because we talked about, now we are saying, let's separate the budgets for water and toilets.
Sanitation. Okay, toilets.
Yes? And also a policy that is specific to investment in sanitation. Should we also separate the water service providers? I mean, because right now, water service provider is also sewer service provider. Should we have water service provider, you provide water, and then come up with sewerage service provider that focuses on sewer?
Well-
Then this one gives them the one primary focus. Kazi yenu ni sewage.
Yes. So I don't think in terms of our own frameworks, we have that in place. It will also take a long time to try and separate them, right? The best we can do is try and incorporate these policies and frameworks to the utilities, right? Because when they know their mandates and they know they are very clear and the budgets are coming in separate buckets, they will know what should be for what, right? Now, the second part is also how are we enabling them? How are we capacity building them to actually consistently think about the separation and how their investments are going in both water and sanitation. They need to be thinking about them complementarily.
Right.
Yes, not even as separate issues, because sometimes you can't construct. Yeah, you can't construct a pipe, a water pipe, and the water pipe is going through dumped sewage, right, into the houses, and the houses don't have toilets because that's where the sewage is coming from, right? And so it's just a mind shift. And so enabling them and capacity building them to be able to now implement both alongside each other.
Okay.
Yes.
I think, the separate budget lines will help a lot with that, because I can see how easy it is to, I don't know what's the easier part of this half. If you're doing water and sanitation, you're in Awasco, for example. I don't know if water is the lower hanging fruit, then sanitation becomes an afterthought. Yeah. Okay.
Also because I think of our focus. I come back into, if we don't think about toilets, then the policymakers and all will not be responding to our needs. They come and talk to us about water, tutaleta maji, tutajenga shule, tutajenga hospitali, and barabara, because those are the things that we've fronted as priorities.
True.
So I think it's in the population of this country for toilets to become a priority. They are not.
Yeah, and I think before Wali goes, it's also to throw it back to what more we can do. We're doing what we're doing here, you know, with Latif and Mariam about amplifying, but just generally, what can people do? You know, it's easy to say campaign for or push for toilet, but at a granular level, how can we make this conversation bigger and almost something that we carry with us a lot, so that whenever there's an opportunity, you're getting people to think about how we need to think about toilets. Because right now, people are just moving. I was going to ask, there's pit latrines, there's container-based. What's a good mix of models, especially when it's a rapidly urbanized place? What's a good mix of models to?
Oh, yeah. That's actually, that's a great question.
Yes.
So
Otherwise,
think of like, if only 15% of us are sewered, then the non-sewered in urban areas, because like you said, sometimes whether you have 10 acres, you could survive 3-4 pit latrines, you know, but it's a really good question.
Yeah, just a mix, because otherwise it's easy to assume, here we put this.
Yeah.
We should go with sewer.
We go,
Or here we should go with latrines, or here we should,
Yeah, so right now, globally, we are all shifting towards citywide inclusive sanitation. We have to take on the integrated approaches that you're talking about. There is not a good mix, which is a one-size-fits-all, because contexts are different, right? A good example is what is being done by Nairobi Water right now. They have recognized that in the urban informal settlements, they will not be able to rehabilitate or extend the sewer lines. So what are they doing? They're doing the simplified sewers, and Fresh Life is providing the container-based sanitation models, which are working hand in hand, right? We are seeing in the rural areas, because people have more space, there might not be need for actually regular emptying, right? Just because of number of people using per toilet. Pit latrines would be a good model to have in those areas. Peri-urban areas, we are also seeing a mix of both non-sewered and sewered systems to some extent. Simplified sewers, or because of the expense also. The capex expenditure required, the capex investment required actually for sewer systems
sounds expensive.
Sounds very expensive. And it's not just the capex, the O&M costs also, operations and maintenance, right? When you think about why our sewer systems are not functioning optimally, it's the operations and maintenance costs. Because over time, these will break, they will need replacement, they will need fixing. Every time you need to fix a sewer line, you have to move people, fix the sewer line, and it's also budgets that you have to plan for, because it's not a small amount of budget. When you think about more innovative models, which are non-sewered, it's very easy to fix, because you can always have a lower cost of operations and maintenance for those systems. Yeah.
Counties, like we've said, it's a devolved function. What counties would you say are leading in terms of toilets, sanitation, water matters, and where do we need the biggest, fastest interventions? And then perhaps you can tell us what the counties that are getting it right are doing.
Great. So right now, the counties which we're seeing leading is, one example is Nyeri County. Nakuru County has done very great in terms of actually the full circular economy model in sanitation. We're also seeing Nyeri coming up very well in terms of planning, especially as the population growth increases, they're doing a very great job of making sure that treatment is for all the waste that is in the sewer systems, but also the non-sewered systems are getting the waste to the fecal sludge treatment plants. And what these counties have also done in terms of getting to where they are and leading in the country in service provision, it's the goodwill of these county governments. Yes, and the goodwill of the service provider, who is the water utility.
Yeah.
Yes.
Okay.
Yeah.
When you say the goodwill, I mean, obviously, does that mean they're budgeting more for it? Also, yeah, they're budgeting
Yes,
more.
they're
that's it.
budgeting more for it and intentionally
Okay.
being focused on access to people,
All
right? Yes.
When you
We
think
are-
of the counties now with the highest, perhaps, or who are furthest from achieving like, our sanitation goals, which ones are these?
Most of the counties that are farthest from achieving the sanitation goals, of course, are the ones in the ASAL areas. So we're talking about Turkana, Wajir, Garissa, Marsabit areas. And this is also because we need to think about systems which will cover, they don't have the dense populations we have, even because people are sparsely populated. So how do you think about a system that will not be expensive to maintain, but also affordable to the people? Because then you look at also the affordability of these systems, right? And again, it comes down to budgets, right? When we look at national government budgets, the budgets are usually mostly in the cities because these are where the populations are large, right? And so are we deciding to budget for cities more than the rural areas or areas which have no densely populations? And I think it's just a prioritization thing, yeah.
It's, I get the prioritization. I'm also like, is it also just, like you've said, localization and solutions that are, because I don't imagine a pit latrine in an ASAL area would fill up quickly.
Exactly,
Right?
yes,
Okay.
yes. But can it be constructed in a dignified manner?
Yeah.
Just not a makeshift
Yep.
pit latrine,
Latrine.
right? Because again, we are talking about climate action. Are you building a pit latrine with ensuring that the emissions are also lower, right? When you build it in the city, is it going to be enough for the people? When you empty it, where is the waste going? So you have to just think about those two things and all those factors along the sanitation service chain for those people and the
I want
communities.
to ask, in terms of where the waste is going, because that keeps coming up, what are some of the health hazards that you're most worried about right now? I know they've been there since time immemorial, but is there something right now that makes you really nervous because we're not managing waste and it's coming closer to us? What comes to mind?
You told us this last time, but how many treatment plants do we have in Kenya?
Wow, how many? We have at least over 115 wastewater treatment plants.
And there should be.
There is no, you can't say how many there should be because then the treatment plants need to be constructed to fit the population and the
Got it.
amount of waste that is being generated in those counties. So I'll talk about it from a county perspective because then the treatment plants are supposed to service counties. So right now in Nairobi, for example, we have two treatment plants. We have the Ruai treatment plant and the Kariobangi one, right? All different processes. But is it even enough to treat?
Yeah.
Is the capacity enough to
Yes.
treat all the waste that is in Nairobi currently?
And as a result, what
Right.
happens? What are you concerned
So,
about?
of course,
Yeah.
as a result, we are seeing the current sheet flow diagram again. Sorry, Janet.
No, it's fine.
It is what it is.
It is what it is.
Yes. Shows that 47% of Nairobi's waste is not safely managed, which means 47% of the waste is not being safely managed. It's not getting to treatment, actually.
Okay.
As a slight 15% of that is the sewers, the off-site systems, which is the sewered systems, not getting to treatment, which means there are blockages, there is breakages, there is maintenance issues, and it's leaking into the environment, into the
my
waterways,
word.
into our Nairobi River. We know about the Nairobi River Regeneration Project. That's why this is happening, to clean up the Nairobi River. Now, the rest of that percentage is actually on-site systems, the pits that are in our informal settlements largely, because truck exhausters cannot get there.
Yeah.
Manual emptiers will empty the waste, right? But where are they taking the waste?
They will not go to Ruai.
They cannot push
Yeah.
the ambulance
Yes, I remember we talked about
Yes.
the
all the
ambulance.
way to Ruai,
Yeah,
right?
the ambulance.
And so we need to think about
Just remind our viewers, there's someone who wasn't
Who-
there last time who doesn't know
There's-
what an ambulance is.
So an ambulance is basically a barrel on wheels, a 200-liter barrel on wheels, sort of like a mkokoteni, right? And then that is filled with poop. It's actually not poop because it's fecal sludge. It's a mix. Yes.
Wali.
And so,
So
when
this
it's
is the
walking on the
extractor.
street, yes, when you walk on the streets, you have to actually give it way. The same way you give way to an ambulance when it's rushing someone to hospital.
I
And
think
so
here
when you
instead
think
of
about
the
the
wee-
numbers, yes,
Yeah,
when you
instead of
think
the
about the
wee.
numbers, it
And-
should just be what is contextually
Yeah.
perfect for that, for those areas and for the population that is generating the waste.
Okay.
Is in your estimation, do we need to build a new ROI, or do we need to expand ROI, or do we need to make ROI more efficient?
I think we need to rehabilitate it, expand it to some extent, and then make it more efficient. Because a lot of what we understand, Nairobi Water are our partners, very good partners, and we do understand the challenges that they are facing in terms of treatment of the amount of waste that is getting there. So efficiency will obviously drive complete treatment, right? Again, if they are allowed to allocate more budget to sanitation, they'll be able to rehabilitate most of those sewers. In the next 2 years, we can see with their upcoming strategic plan, if this is a possibility, if this happens, actually we'll see the reduction of that percentage in terms of unsafely managed waste. Showing.
We have a minute or so, even less. What do we need to do, Wali? Just challenge us, challenge viewers and listeners. What more can we do? What more should we do? Yeah, just to prioritize this issue.
Yes, so to be able to prioritize this issue, I would encourage all of us to actually come together and think about the toilets, like Eric said, continuously think about the toilet, but also advocate, right? Advocate for ourselves, and then help the government also figure out the solutions, right? For private sector players, they need to be working together with government to design these solutions. We are talking about innovative solutions. Number 3 is financing, right? There's a huge financing gap for sanitation. How do we also mobilize the money? And most of it is coming through us working together with the government, right? Public sector players, private sector players, all working together towards the same goal. So if our goals and priorities are aligned, that is going to work.
Right.
Thank you very much.
That was-
Wali, Wamugongo.
Thank you.
That was a great conversation.
It was really good. Marking World Toilet Day, lest we forget. Every year, November 19th, but we need to take the message and the thought of this beyond November 19th, because it'll be a whole other year. We'll be like, oh, are we still at 3.6 billion? Oh, have we made any headway? So thank you very much for weighing in on that. Next up is...
We need a toilet every day.
Yeah, toilet
Every day.
Several times a day.
Yes.
Yep. Next up is presidential aspirant and newly appointed deputy party leader of Jubilee Party, Dr. Fred Matiang'i. They'll be talking about his thinking and his vision for the country. Of course, he's going to tell us what he thinks he'd like to fix if he were to get the presidential ticket and then he was to be elected by Kenyans as the president. What it is that he's fixing, and then look at whether we have actually seen him having the capacity to fix it when he served in the public. Keep it here for that. It's coming up to 8 a.m.